Hello, everyone. Thank you so much for joining us for our UHS Training Webinar. This is for the Quality and Improvement Activities in 2019 presented by HealthMonics. We're going to give everyone just about 2 more minutes to sign on, although most of you are here, so thank you for joining us, and just hang tight and we'll get started in a moment. All right, we're going to get started. So thank you again for joining us for today's UHS Training Webinar. Let's go over today's agenda. We're going to go over some introductions, and we'll have a part on uploading the quality data. Then we'll go over the improvement activities of MIPS. Then we'll have a live demonstration. And then we'll also have an open Q&A. I do want to point out that in the webinar widget to the right, you should see a handout section where you can download these slides. And for the open Q&A session, you will have the ability to raise your hand, and I will unmute you and you can ask your question, or if you'd feel more comfortable, you can write down your question in the question section of the webinar widget, whichever you prefer. So we will have that opportunity for anyone to speak and ask questions as they come up with them, and of course you can always ask questions after the webinar. All right, so for introductions, my name is Kelly Healy. I'm the account manager for UHS. And then we also have Alan Moore and Lisa Papone on with this webinar, and I'm going to let Lisa talk for a little bit right now.
Thanks, Kelly. I just wanted to kind of give everybody a little overview of the changes and kind of what Kelly's going to go over today. So as we've been communicating, we'll be using HealthMonics this year for our MIPS reporting. So they have their own software system that each facility will have their own site that they'll work in and complete all of their MIPS data entry that we'll use for submission. It is, at first you might feel it's a little overwhelming, but it is pretty easy to use once you get used to it. And the folks at HealthMonics are, they have a help line and customer service that are available, and I can try to answer questions too as you go through that. So right now I've created the site for each facility on the HealthMonics software. The PI director at each facility has been set up as the administrator for your site, and that person should be the primary person responsible for managing the site and completing the data entry. If for some reason during the year that position changes or something changes, please let me know. I can add a different person to have access. And I've already loaded all your quality measure and improvement activity measures onto your profile based on what each facility submitted to me. So please don't change any of these choices without speaking with me first, because it may impact your, whether you meet the reporting requirements. Your billing company is also aware that you will need the spreadsheet of all your physician billing to upload to this site. Alan Moore sent an email with instructions to the CFOs earlier this week, or I think last week, with what information needs to be on the spreadsheet. So the CFO will need to coordinate with the billing company to receive these spreadsheets either monthly or quarterly and provide them to the PI director to upload to the MIPSPRO site. We've also will be working with MHO to provide the spreadsheets of the applicable IPFQR measure data that the PI director will upload to the site. So for those of you that are reporting on the alcohol, tobacco, or flu vaccine measures, we will be able to pull some of the information that's already been entered in your HBIPS and IPFQR pages to carry over to this site. They'll send me the spreadsheets, and then I will forward to each PI director so that you can upload. And they have told me that they should have Q1 available by the end of this month, and then we'll be providing monthly spreadsheets going forward on a more, frequent basis. But just keep in mind, in order to receive these timely, you will need to make sure that all of your HBIPS data entry is completed on the portal by the deadline each month. And then you'll need to make sure Kelly will go over the process, but you'll need to make sure your billing and quality measure spreadsheets are uploaded before beginning any data entry on the MIPSPRO site. And you should also refer back to the quality measure code guide that I sent out this week that gives you kind of a cheat sheet on entering the codes for each of the measures, whichever measures you have identified for your MIPS quality measures. It gives you corresponding information when you're auditing to tell you which code you need to enter. If you have any questions on that part of it, I can certainly help out when you get to that point. So I'm going to turn it back over to Kelly now to go through the demo.
Thank you, Lisa. All right, so we're just going to go into a little bit of who Healthmonics is. So Healthmonics, what we do is we improve the quality of today's healthcare while providing an outstanding customer experience for healthcare providers, administrators, and patients. We've helped thousands of healthcare professionals achieve the top 1% level of quality reporting while combining quality measurement technology and clinical education tools. Our goal is to make technology rewarding and not frustrating. And a couple of things that we offer, we do have our Healthmonics blog called the Healthmonics Advisor, and that's always offering the latest industry news and quality reporting advice. This is available on our main website, and if you download those handouts, this is a hyperlink right to the blog. Should you be interested, we also have our 2019 MIPS Survival Guide, and that covers everything you need to know, although Lisa's taking care of a lot of the more difficult aspects of that. And here's our customer support information. So we have a lot of live support options. We're available by phone. Here's our phone number, 610-590-2229. Option 2, if you call in, you'll hear a phone tree that tells you to click option 2 for customer support. We also have our 888 number at the bottom of every single page when you're logged in. So we try to, make it really easy to contact us. We also have our support email, support@healthmonics.zendesk.com, where you can reach us, any time of day. So if you're like, I have a question, it's not super urgent, just send us an email. We get back to people very quickly. And we also have our live chat option on the website as well. So if you're in the website and you're having trouble, you can just start a chat with us. Our hours are 8 a.m. through 6 p.m. Eastern time, Monday through Friday. And we also have some self-service materials. So we have our webinars, so we can always provide recordings to past webinars, or you can sign up for other webinars. Obviously, this one is catered especially to you guys, so that makes things even better. but you can always attend some of our other webinars should you be interested. We have our monthly newsletter that you can sign up for. We have guided system tutorials, which you can access by hitting the help button. And we also have our Healthmonics help desk. We have a link to that at the very end of this webinar. And also when you type in questions in the help button, that will link to help desk articles as well. So after attending this webinar, attendees should be able to log into the Practices UHS account and upload the quality files into that same account. You should be able to add the missing numerator codes to the MIPSPRO account using exports and instructions provided, and then also attest to the improvement activities in the account. So let's get to it. We're going to go over logging in and uploading files. Now I am going to briefly go over these slides. I'm not going to spend a ton of time on them because I want to concentrate on the demo. I think that's a little bit more inclusive and really shows you what you have to do. These slides are really for your reference later. So it's just a good reference for you. But I'm going to go over them. But I don't want you to worry if I'm going too fast. You're going to see it again. And you're going to see it in real time. So logging into UHS MIPSPRO, first you need to go to uhs.mips.healthmonics.com. And you're really going to want to, I recommend, bookmark this website in your web browser. That's going to make things a lot easier for you. You don't have to, I know a lot of people will just end up Googling things like Healthmonics, and you're going to end up on the wrong website if you do that. So really just make sure you go to uhs.mips.healthmonics. Again, this is a hyperlink right in the handouts, so you can just click that. And then from here, you're going to click on Sign Up and create password for the email assigned to the practice and access the account. And just a little bit of a warning, we do have some security enhancements that are going to be implemented later this month. So you might create a password like today, and then you might have to change that password. So you'll just basically sign in, and then it'll just ask you to change your password. So nothing you did wrong, just some security enhancements that we're doing just to make everything even more secure. The next step that will happen once you get logged in, you will click on the admin button, and then you're going to go to the dashboard. Once you're in the dashboard, you're going to see a message that says complete your profile. Once you click there, at the very top of the page, you're going to see that most of the sections of the profile have been completed. They have a nice green check mark, but the waiver has an open circle. You're going to click on waiver, and then you are going to just complete the waiver. Now, this waiver has been approved by UHS, so you don't have to worry about getting further approval or anything like that. You just have to sign it. Once you complete your waiver, you're going to end up back on the dashboard, and you're going to see quality has a continue button next to it, so we're going to click there. And once we click continue next to quality, we end up on the data entry tab. And from that data entry tab, at the very bottom, we're going to click on the data integration page. This is where we're going to be uploading all of our information. So on the data integration page, we're going to click upload visits. So if you see here in step number 1 on the screenshot, highlighted in blue, upload visits. And then in step number 2, we're going to choose the file to upload. And then in the upper right-hand corner where we have the screenshot sort of highlighted in blue, we're going to do step number 3. Once you choose a file to upload, you get a pop-up, which is this highlighted in blue screenshot, and that has 3 questions for you. Now, what's really great is you just have to click continue. But I do want to explain what these questions are just for your knowledge. So question 1 asks, if the file has column headers. Yes, all of your files coming from your billing will have column headers because UHS has made sure that all the files are working, so that's fantastic. And they all have column headers, and that's our default always, so you don't have to do anything. Number 2 is, do you want to overwrite manual updates with this file? No. Now, nobody should really be doing, well, you might do manual updates actually when you're adding numerator codes. So leaving that at a no is the best choice. So and that's the default, so we leave it there. And number 3, when encountering existing visits with codes, do you want to overwrite all codes or append new ones with this file? You should always just be adding information, so append is really the best option. Overwrite is really for fixing mistakes. So if you feel like you need to change that to overwrite, that's really a conversation that you need to be having with customer support. You never want to choose overwrite just willy-nilly. So you should just always leave the default and just click continue. So things are relatively easy for you. Then we get another pop-up, and this is the column mapping pop-up. Now, UHS files will all have headers that map each column automatically. Now, with your first upload, you might want to just make sure that all the columns are mapping automatically. It's good to make sure. And once you get that confirmation, you can just click on Complete Upload Process. Again, you'll see all of this in the demo. Once the file has completed uploading, we're going to click on the Quality Performance page, which is always in the upper right-hand corner of the Quality section. And this is going to be your main page that you're always checking. You want to see how you're doing. So once we go to the Quality Performance page, we need to focus on the columns that say Total Instances and Complete Instances. The difference between the Total Instances column and the Complete Instances column shows your visits that need numerator codes. Really, when you first upload, you're not going to have any complete instances, but occasionally you might have one or something. So what we want to do is click on the number in the Total Instances column, and that's going to bring us to the patient visits for that measure. So once we end on the visits page, we're going to look in the filter section under measure status, and this is going to show us which measure we're filtering for. So you want to select the measure number that you want to complete and make sure that you always have incomplete selected and visits in the performance report. And that's what's highlighted in number 1 in the screenshot there. Once you make sure that that's filtering properly, you click filter in step number 2. And then in number 3 in the screenshot, you can export that to Excel. And you can see in number 3, there's also the option to include a patient name. So that's really helpful, and you'll see why in just a moment. Once we get that export from Excel, you're going to find a spreadsheet that includes the patient ID, dates of service, patient names, and measure numbers. Now, it's going to include the measures, all the measures that you have on your account, but you just filtered for one measure. So what we're going to do is delete the extra information. You just want to focus on your measure. So I'll go over how to do that, but you can see in the screenshot, you can highlight, right-click, and then select delete, as I have highlighted in the screenshot. And then you want to make sure that you save that file under the measure that you have just done. That's really important, is making sure you save these files in a way that you remember what you're doing. Sometimes people forget to do that, and then they can't find their files, and then you have to do it again. Once you have those files pared down, you end up with a very simple file that's usually just 3 or 4 columns, And now you can review your charts and add the missing numerator values. So you can see here on this slide that I have two examples. I have an example for measure 47, an example for measure 226. Now for measure 47, you just have to add in the corresponding numerator code next to the patient ID, and you can find these numerator codes in the measure description, and you can find those measure descriptions on the performance page. And you can see here I have 1123F, that's a MET performance code. 1124F, that's an exception, that's sort of like a neutral performance. And 1123F space 8P, that would be a not met code. So I just wanted to show you all the different codes that you could possibly put in the spreadsheet, and you just would put that with the proper patient ID depending on whether or not they had a care plan. That's measure 47. Now, there are some measures like measure 226 that may require multiple numerator codes. For UHS, you only have measure 226 is your only complicated measure that's like that. So I wanted to make sure to include that example here. And if you're having difficulty with measure 226, we can assist you with that. I did just talk with Lisa today, though, and I think you will probably be getting separate files with values for measure 226. So hopefully this will not be much of an issue for anyone. But
Kelly, so I can speak to that. Yeah, so the patients who were chosen in your HBIP sample will have the codes for 226 and the alcohol measure and the flu vaccine, if you have that one already filled in. However, you will have patients who you will need to fill in if they weren't chosen in your sample. And so in the guide that I sent out to each facility, it will tell you if, it will give you the scenarios. If the patient is a smoker and you put this code, if they've received the tobacco cessation, you put this code. So just follow along with that guide that I sent out for the ones that you have to fill in.
Perfect. Yes. So they made this measure what's called multiple strata, which is why it's a little bit more complicated, unfortunately. That's why it's so oddly complicated. But you can see in my screenshot here, I have in column C, smoker met. That means a smoker who was screened for tobacco sensation. They get those 3 codes. A non-smoker, they just get 2 codes. And for the third row, a smoker not met, that would be a smoker who was not screened for tobacco cessation. They will get those 3 codes. So I just gave a couple examples there. But again, if you have any trouble with this, customer support is here to assist you with that. We get a lot of questions about measure 226. We are experts. Then, once you save that spreadsheet, you just have to upload it just as you did with your original file. So you'll upload the spreadsheet, and then you want to make sure that everything is mapping correctly. Now, because the header just says 226, for example, that wouldn't map automatically, so you want to make sure that those numerator codes map to codes, which is what I'm displaying here in this screenshot. And then you just complete the upload. And that is it for the most lengthy part, the quality part. It takes the most. So now we're on to the easier part, improvement activities. So when you're ready to attest to the improvement activities, you go to the dashboard, and then you're going to click on Continue next to Improvement Activities. Now, these activities should already be selected for you, and if not, if you don't land on the screenshot that looks like it does on this page, the Track and Attest page, discuss that with Lisa. There could be some complicating factors of whether or not you are considered a small or a large practice in CMS's eyes at this time, with the billing time. Sorry, I'm struggling for my words. So we'll double check probably in September to make sure the size of your practice. But that's a discussion that you can have with Lisa to make sure that you guys are on the right track with your improvement activities. You will just see that when you log in and you check your improvement activities section. If there's any issues, discuss that with Lisa. But for most people, you're just going to click on Add Start Date. Once you click Add Start Date, you're going to end up on this page, the Track Progress page, and you just have to add the date the activity started and the date the activity completed, and the dates must be at least 90 consecutive days. Now, you can attest to the full year, of course, but you cannot attest to a date that has not yet happened. So, for instance, you cannot attest to the end of the year because we are only in June. So this is attesting to the improvement activities is something that a lot of people don't do until January. So, and you'll see it takes like 5 minutes to do. So that's something that you can wait on. It's not something that takes a long time. The most of the time for improvement activities is what you're actually doing in your practice, making sure that you're doing the activity. But attesting to it takes no time at all. We do have a section on this page that says upload files. Uploading documentation of the activity is completely optional, but should you want to, you can, and we will keep it safe for you. Then you just click on the Save button. Once you click on the Save button, you'll end up back on the Track and Attest tab, and then you can click the Attest button. From the Attest button, you will have to put in your initials and your signature, and then save. Now, once that is finished, you're done with the Track and Attest tab, and then you end up on the Requirements tab. And from the Requirements tab, you will see Activities to Send to CMS, so you'll go to that page. And from that page, you just make sure that your activities are checked, and then you save and continue, and then you are all done with the Improvement Activity section. All right, now we are ready for our live demonstration. So just bear with me a moment. Okay, so I have my screen up here. Nope. So you go to uhs.mips.healthmonics.com and you end up here. I don't know why it's so big. Just shrink it a little bit. And you will click on Sign Up, and you just type in your email address. Sorry for I got interrupted. I apologize for that moment of silence. So you just fill out your name, and then you will create a password, and it'll require a capital letter, 8 characters, special character, and a number. So you just create all that, and then you click Create Account. Once you create the account, you will automatically be logged in. Since I already have an account, I'm just going to log in. And then we are going to click Admin. And then we are going to go to the dashboard page. Now the profile should say, so when you go to the dashboard, it will look like this. It'll ask you to complete your profile. So we're just going to click there. And you will see all the green check marks. So you just have to click on Waiver at the very top. And you put in your initials. Uh-oh. I must have made an error in my waiver. Let's try that again. If you don't do it exactly, it will not work. All right, check there, save and continue. I might have hit dashboard, that must have been the problem. Okay, now I've got my waiver signed, so I'm going to go to quality and click continue. And as we discussed, you land on the data entry page and you click on data integration. Then from data integration, you click on upload visit and we choose a file. And from here, I'm going to find my file, my UHS sample. And remember, we just have to click continue, very easy. We're going to double check my patient. All my mapping is good, so we can see everything's mapping. Basically, we don't want any ignores that don't make sense. So we don't map provider names, so that's fine. That says ignore. But everything else is just codes, 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 codes. So that's all good. Code modifiers, perfect. So I just click complete upload process. And we'll just give it a moment. You can see it runs pretty quick. All depends on the size of your file. Should you have to upload multiple files, I could get another one going at the very same time. So you do not have to wait for one file to finish before getting another file going. If you're doing quarterly, I don't foresee that being something, but you could just do them back to back and the system will keep on processing. So once that pop-up disappears, that means the file is done, so I can go to the quality performance page. And we see right here that I don't have any complete instances, so I've got to fill in this performance. So I'm going to click on the total instances column, and I'm going to end up on the patient visits page. And we can see here in the filters, I've got it's filtering for METs, not METs excluded, and incomplete. I just don't have any METs, not METs, or excluded, but I am going to X out of those filters and filter again, just to show you. And we can see it still says 17, but I can change this to any measure. So I could change it to 110 and get that value. There's only 4 for measure 110, or I could change it to 226. But what I do want to do is measure 130. So measure 130, for those of you who aren't as familiar with the measure numbers, that's documentation of medication. So what I'm going to do is I am going to export this to Excel. There's that little checkbox. I'm not going to include patient names just for HIPAA reasons. Oh, it's asking me. I'm just going to save this as measure 130 right now. Okay, well, yes, I've already done this from last week's webinar. We're going to call it measure 130.2 so I can differentiate. I'm just waiting for my Excel to open. It's going to take its time. There we go. Enable editing. And so you can see here I've got a couple of extra columns that I don't really need. So I'm just going to delete that. I just highlight the column and I right click to delete it. So yes, delete. I want to keep 130 because that's the measure I'm working on. So delete everything else. Now I'm going to go back to the performance page because I need that numerator code to put in. So you just click on this highlighting. It gives me the measure description. So here we have the instructions, description, denominator, numerator. So we have the performance met, exception, and performance not met. So many people know that they have 100% of the time documented their medications because of the way that they are, the way they have their practice set up, the way their EHR works. They have to check medications. So they feel very confident in saying 100% of the time they document medications. Should that be the case, this is very easy. You just copy this cell. Usually I just scroll to the bottom, hold down Shift, click there, and then paste. Just do Control V. Now I'm going to save that. And I'm going to upload that new file. So anytime to get from back to quality, you can just click Quality Checklist in the upper left-hand corner. And we're going to go back to the data integration page. And we're going to go back to Upload Visits, choose a file. There we go. Continue. Now this says ignore, so I'm going to change that to codes and complete the upload process. And we'll just give that a moment to process. Hope everyone's with me so far. Almost done. We'll go back to the performance page. And now we have 100% performance. Now, obviously, that's the easy bit when you already know your performance. Should you have to look things up, that does take a little bit more work, but hopefully less instances. Measure 131 might be the same, pain assessment and follow-up. But if you keep up with this, it won't be so much work. And again, customer support here to help you with any questions you might run into. Now we're done with quality, so we're going to go back to the dashboard. You can click dashboard, or you can click your name. And we're going to go to the improvement activities. Now, the activities are already selected, so you should end up on track and a test. So I'm going to add my start date. I'm going to say February to yesterday. To see upload file, I can write myself little notes. Maybe I want to say where I store my documents to back this up. I could leave a little note there for myself, some breadcrumbs. Now, you won't be going to this ready to submit page. That's just because I've done this before and I had to undo it on my end. Now we click on a test, and we're going to enter my initials and my name, and we're going to save. And now that's all completed. Now we go to the requirements tab, and we'll go to activities to send to CMS. And we can see that I've got 15 out of 15. Selected activity weight is 20. Required activity weight is 20. That's selected. I just have to save and continue. And that's everything you got to do. We can't submit until January. So improvement activities is done. And that's really all you have to worry about. So I'm going to open up the floor for questions now. And I just do want to point out we have our further resources available, but let's get to questions. So I don't see any written questions. So let's see if we have anybody raising their hand in the audience. All right. I do see Beth Williams. I'm going to unmute you so you can ask your question. Hi, Beth. Attendee can't be muted until they enter their PIN. Let's just enter their PIN. Okay. Beth, it looks like you didn't enter an audio PIN for me to unmute you. And I sent you an audio PIN via the GoToWebinar, or would you like to type in your question? All right. Let's see. Okay, Beth is asking where can you get a printable version of the slides. So in the webinar widget, there is the, do you see the handout section where you can download these slides? I hope you can see that.
This is Alan. If you can't find that on the widget, the CFO's got a copy last week that can give it to you.
And also customer support also has the handouts of the slide as well as a recording of this webinar. So should you need that, you can also contact customer support and they will be able to give you a copy of the slides as well. All right. Don't see. No other hands are raised at this time. No other questions so far. We'll give a couple more minutes. I would say Lisa and Alan, if you want, should we end the webinar at 1:50 if we don't get any other questions?
Yeah, I mean, I think if nobody else has raised their hand or asked questions, I mean, I think probably people will come up with questions once they start getting into this and have questions. So it's probably right now they're not sure the questions to ask. But yeah, we can finish, and if nobody has anything else, and they can contact us or contact customer support if they have questions.
Yeah, that's usually how I feel sometimes when presented with something new. It's like I don't even know what question to ask. So, well, I want to thank everyone for joining us today. I hope you found it informative. And please don't hesitate to contact customer support with any questions. We are here to help you through this process. And I do promise you will get the hang of it, but we are here to help you. So do not think you have to do this all alone. Like Lisa said, she learned it. She was like, whoa, at first. But
I was definitely overwhelmed the first time I went on, but once, we walked through it again or I kind of made some notes, it gets very easy to follow. So
yeah, I really do think it takes like 2, maybe 3 times doing it, and then you're like, oh, it's not that bad. Right. Just like anything.
Thank you for the webinar, and we'll, like I said, everybody can download the slides and they can contact customer support if they want the recording for anybody. And I appreciate your time for going over this.
Oh, it's my pleasure. I hope everyone has a great weekend. I think we're good to end it. No more.
Thanks, Kelly.
Thank you.
Thank you.
Bye.
Bye, everyone.